Okay, are we ready?
Yeah.
Should I begin?
I think go ahead.
So good morning, everybody. Thank you so much for joining us today for the first ever Global Counselling Psychology Forum seminar that myself and colleagues, in particular Charles and Mike and Anshitosh and Chloe, have done a lot of work to get going for today. We're going to be talking about the professional identity of counselling psychology, moving towards a global consensus in the way that we view our values, our principles, and the guiding ethos of counselling psychology, in the hope that when we say we're counselling psychologists, we don't necessarily then need to go beyond saying that we're counselling psychologists and we have global recognition around the world. So I'm going to swiftly hand over to our panel this morning, and that will be Charles, who is currently based in Australia. I'm sure he would introduce himself. I'm going to hand over as well to Anshitosh, who's our colleague in India, Mike, who is in South Africa, and our colleague Chloe is in the UK, and we'll be talking on to the Counselling Psychology Position paper. Thank you, guys.
Thank you. Thanks.
Thank you.
Yes. So my name is Charles Young, and as you've heard, it's afternoon here in Perth. And so I'm going to kick off with just a few minutes to do a little bit of a background presentation, and then the other members of the panel will come in and respond to a couple of questions that this raises. So I'm sure that, okay, so I hope you can see the same screen that I'm looking at with the quote, "The practice of counselling psychology has a short history and a distant past." And I expect that most of you will know all of this. The origins of counselling psychology are American. The root of counselling psychology is the vocational guidance movement of the early 1900s. This was subsequently joined with the psychometric movement in the 1920s, which expanded the activities from guidance to testing and guidance. And then a burgeoning interest in psychotherapy had a profound influence on the trajectory of what was to become counselling psychology in the 1940s. In particular, Carl Rogers's work was highly influential. And this also laid the foundation of what was later to become a philosophy of counselling psychology. Alongside some major global events, the progression was towards a specialty in psychology with interest much broader than vocational guidance and counselling. And this culminated in the birth of counselling psychology in 1951, which was an explicit acknowledgement that the concerns of people who'd been a member of this division had grown from vocational interest to a much broader concern with the development and well-being of people. The Division of Personal and Guidance Psychology changed its name to the Division of Counselling Psychology. And after that, there was the birth of various counselling psychology journals, and the specialty grew rapidly. The professional identity of counselling psychology was subsequently refined over various conferences in the US. So the Northwestern Conference in 1951 was when counselling psychology was birthed. And then there were some others. The first one took place in Greyston in 1964. Now, what was interesting about this conference were the kinds of issues that were raised that will resonate with many of us today. concerns were raised at that conference about counselling psychology lacking a distinctive professional identity differentiated from clinical psychology. There were concerns about the lack of visibility of counselling psychology. Other concerns included that the emphasis on high geology had prevented the necessary knowledge and understanding of pathology and diagnosis. And then way back in 1964, there were calls for counselling psychology students to be financially supported in the same way that clinical psychology students were. And of course, that's an issue that's been a very contentious issue in Ireland and the UK. Then in 1987, there was the Atlanta conference, and significant about that was the way multiculturalism was incorporated into the professional identity of counselling psychology. And then in 2001, the Houston conference recognized that kind of multiculturalism would inevitably extend to social justice. And by 2001 at the Houston conference, the view was that the professional identity of counselling psychology was relatively settled, and that the philosophical orientation was what holds the specialty together in the US. Counselling psychology, conceived as it was in the US, has been adopted more or less intact in countries elsewhere. These places include the United Kingdom, Ireland, Canada, Australia, New Zealand, South Korea, Taiwan, Hong Kong, South Africa, India, and other places. Of course, the UK is slightly different in that counselling psychology is the marriage of the different professions of counselling and psychology. In some countries, career counselling is still very much a part of what counselling psychologists do, but the trend elsewhere seems to be that these roles are separating. But nevertheless, global surveys like the one of Hutman et al. Suggest that although each country's particular national context clearly has an influence on who counselling psychologists are and the professional functions they fulfill, there are similar features that transcend international borders and provide a unified picture of the specialty. In other words, counselling psychology, as it may be different in different contexts, is globally recognizable. From the start, though, in the 1950s, there was a prediction, a recognition, or a concern that counselling would inevitably converge with clinical psychology. And certainly the two specialties are historically much more alike than they are different. And increasingly that whatever differences still exist have for some time been fairly minimal, and in some cases seem to be diminishing. Different countries have approached the definition, a way in which we distinguish counselling psychology from other specialties, and specifically clinical psychology. In some countries, it was about sort of locating the two categories on different ends of what has been described as a normality pathology distinction, with the idea being that counselling psychology from the start had an interest in sort of everyday adjustment issues, whereas clinical psychology was associated with more severe psychopathology. The problem with this distinction is really twofold. One is that counselling psychology has evolved, and that distinction has diminished. The other one is that it's an impractical one. Clients tend not to stay on a fixed point on that continuum, and the sort of regulation is impractical. So in countries like South Africa and Australia, there's been lots of work to try and remove these unnecessary, impractical impediments on the practice of counselling psychologists. Because what typically happens when jurisdictions make this kind of distinction is that the restrictions are applied to counselling psychology only. There isn't a reciprocal restriction on clinical psychology. So you have a situation where clinical psychologists work across the spectrum and counselling psychologists are confined to a portion of that spectrum. But in any case, it's impractical. It doesn't make any sense. And it's a diminishing one. Another area of distinction has been that, or that has been researched, is the idea that counseling and clinical psychologists adopt different theoretical orientations. And there's some research in the US, for example, that suggests that clinical psychologists are more closely aligned with cognitive behavioral therapies, whereas counseling psychologists are more likely to adopt kind of multicultural and feminist orientations. However, even there, the majority of the theoretical orientations that were compared weren't different. And for example, in South Africa, we found that clinical psychologists were more closely aligned with psychodynamic orientations, but that's more of a historical accident than a particular ideological commitment. So that's not really been an area of distinction that's sustainable. The most common one is around philosophy and values. We speak of a philosophy of counselling psychology. People talk of counselling psychologists having particular values. We all know what those values are. It's about altruism, positive relationships, integration of research and practice, kind of focus on healthy development, a holistic frame of reference, respect and dignity of people, social justice, and so on. And in fact, in South Africa, we did a survey of counselling and clinical psychologists and a list of 10 of the so-called values of counselling psychology imported from surveys that had been done in the US. And we did find statistically significant differences on most of those different values, with counselling psychologists endorsing the values more strongly than clinical psychologists did. However, when we looked at the actual effect sizes, even though there were statistically significant differences, the actual difference was pretty minimal. And most clinical psychologists seem to endorse many of these values. So whether or not that's a sustainable distinction is part of what we're here to talk about. Which brings me to the roundtable discussion, where we're going to consider these two questions. What makes counselling psychology distinct as an area of practice and research in our respective contexts, and what are the opportunities and challenges in each of our respective contexts. So I'm going to pause there and stop sharing. I think this is where Mike and Ashutosh are going to come in.
Indeed, we shall.
Yes, Mike, would you like to?
And Ashutosh, are you there?
Yeah, I'm here.
Okay, cool. Mike, do you want to perhaps begin?
Yes, I can certainly do that. Yeah, kind of what I'd have to say is largely mirrors Charles's description of counselling psychology. Charles has done huge amounts of research in the field of counselling psychology, including in South Africa. So what he's described pretty much sums up the South African context. I think the differences, what differentiates counselling psychology and makes it a distinct area of practice is possibly more theoretical than practical, that we have a differing philosophy from clinical or educational psychology, but the differences in practice tend to be very minimal. So what clinical and counselling psychologists actually do in practice overlaps to a considerable degree. And that's possibly not surprising. You know, we do very similar things, although, yeah, as I say, the difference is more theoretical, that clinical psychologists are held to be more aligned with the psychiatric profession and subscribe to a biomedical model of mental health. But that's very much a theoretical orientation and doesn't find its way into practice, because what clinical psychologists do in practice is very similar to what counselling psychologists do. And in fact, the field of clinical psychology in South Africa is expanding to include large parts of what counselling psychologists do. Not only is there perception that clinical psychologists can do all things and everything psychological, whereas counselling psychology is more limited, but we have places like Stellenbosch University who have rebranded their clinical psychology training program the Clinical and Community Psychology Program. So they're actually stretching their program out to include areas that were traditionally maintained to be counselling psychology. So what makes us distinct is, yes, we have a more sort of phenomenological approach. We tend to, the philosophy is in South Africa that we see ourselves as working with a person in their everyday setting, within their context, their framework, and recognizing their strengths and working with those strengths, a more psychopharmacological approach rather than a deficit model of psychology, which is where clinical psychology tends to focus. But as I say, that is very much a theoretical distinction and doesn't find its way into practice, because on the ground, they're very much the same. I still have people asking me, so what sets counselling psychology apart from clinical psychology? And they really ask it out of a position of not knowing, because they see that when they see a counselling psychology, we're doing pretty much the same thing as a clinical psychologist would do in terms of therapy. I think the opportunities and challenges in South Africa, I think there are huge opportunities, because I think counselling psychology is possibly better aligned with African values. And some South African universities are trying to develop an African model of psychology. I know that Nhlanhla Mkhize at the University of Natal was trying to develop a more African version of psychology. And yeah, the African cosmology and belief system and culture is possibly more aligned with the values of counselling psychology than clinical psychology, which, as I say, tends to, in theory, have a more biomedical approach. I think that's a huge opportunity for counselling psychology in South Africa. Community psychology is certainly an area of great need in South Africa, and the problem we have there is with regards to funding. The problems with counselling psychology in South Africa is really an image problem. We are equal with all the other categories of registered psychologists. Legally, we have the same powers, the same authorities, the same competencies. We can do the same things in terms of the law. But the public, the funders, the state governments, and people like that don't have a clear understanding of what counselling psychology is. So we have the funding problem, where the government gives bursaries to clinical psychology trainees, but not to counselling. The government pays intern clinical psychologists, they don't pay intern counselling psychologists. So there is a funding and an access problem for counselling psychology. Funders don't understand. I've had one funder through a regulatory body called the Council of Medical Schemes state that counselling psychologists do not provide therapy, which is a terrible, terrible misinterpretation of what we do. We do provide therapy. We do treat mental and behavioral disorders, but the funders don't recognize it. The government doesn't even recognize it. They mostly only employ clinical psychologists within the health services, and the only place where counselling psychologists find a home is in private practice, the correctional services or prison service, and the military medical services. It's I think there's huge opportunities there. Yes.
Sorry, can I come back to you for a second, and we can maybe talk about challenges in more detail? And Ashutosh, what are your thoughts around the distinct areas of practice and research in your respective context?
In Indian context, I don't see much of difference in terms of philosophical orientation or values between clinical and counselling psychologists, because we get through same kind of training at master's level. After master's, people specialize either in clinical psychology or in counselling psychology. So the training difference is basically the practical training that clinical psychologists get with the psychiatric setup, working with clinical population. And counselling psychologists mostly work with non-clinical population, like in relationships, like in career issues, trauma cases, all kind of situations where actually there is no clinical diagnosis or severe clinical diagnosis there. mostly anxiety, depression, or mild cases are also being dealt therapeutically by counseling psychologists quite a lot. But if we look at the size that India is a country of 1.5 billion people roughly, and estimate says that 10% of this population actually requires mental health support, and clinical psychologists are less than 3,000. So actually the entire burden of mental health care is on counseling psychologists. At every place, if there is one clinical psychologist, there are 10 counseling psychologists offering services. But unfortunately, there was no regulator, there was no government recognition, there was no system to support counseling psychology specialty. But the last 4 or 5 years, we have been struggling. We have been doing a lot of advocacy. So the identity has emerged. Earlier, people used to write psychologists, and a lot of identity crisis was there, that whether we are entitled to work, because for clinical psychology, there was a government regulator. For counseling psychology, there was no government regulator. So a lot of students come up with this identity crisis, that whether we are doing some ethical work or unethical, we are quacks or we are unprofessionals, how to identify. But we started this identity assertion in 2015. And now, if we search on LinkedIn or any social media platform, thousands of psychology students or practitioners have started writing themselves as counseling psychologists, because we clarify with government that counseling psychology has no regulator. So if there is no regulator, you cannot be illegal also. And your training entitles you to practice, your training entitles you to help people. And now a lot of people have actually come up in a lot of assertion, a lot of training, a lot of workshops, interventions have all of a sudden started flourishing up. So in India, we can say that we are in the most growing age of counseling psychology.
Thank you, Anshitosh. Charles, would you like to come in here and speak to some of the distinctions from your perspective?
Sure. I mean, I have to say that I've only been in Australia for half a year, but certainly in Australia, the distinction was really around the kind of humanistic philosophy of counseling psychology. And there has been a struggle, but ultimately a successful one, to expand the scope of practice of counseling psychology in Australia. The trouble is that counseling psychology has been almost blindsided by regulations in 2006, which were to give people access to psychological therapies through a kind of national kind of Medicare system. And by a decision, government decision, the rebate for clinical psychology is higher than it is for other psychologists. And Australia is a little bit complicated also because it has a registration. People are registered in general practice, and then they have an area of practice endorsement as a clinical counseling or other type of specialist psychologist. And so, whereas in some countries, counseling psychology sort of fulfills that generous role, here there is a generous psychologist. And as a result of the way the sort of inequities in the rebate, with clinical psychologists, I think, getting $40 per hour more than other categories, there's been a drop in demand for counseling psychology places. And as a result of that, many of the university programs that offered counseling psychology have closed those programs. So, on the one hand, until recently, it's been a very successful story of Australian counseling psychology asserting itself, defining itself with a kind of particular value system, and slowly winning the battle against a regulator that had restricted the practice of counseling psychology. The scenario now is that there are far more challenges then there seem to be opportunities in that there's only one program at the moment, training counselling psychology, which produces 6 counselling psychologists a year. So if it carries on like this, the cohort of people will eventually age out. So the urgent opportunity, I think, for Australia is to reintroduce professional training.
Thank you, Charles. So I'm just mindful of time, but I want us to come to the second question, which you have sometimes answered in the last section. What are the opportunities and challenges in your different respective contexts? I'm going to come back to you, Mike.
Yeah, the opportunities is to better position ourselves. We need to actually go out and market counselling psychology, inform the public and regulators as to what we do. We're busy with that in South Africa. We are gaining recognition that a body called in South Africa called the Council for Medical Schemes, who are the private funders of healthcare in South Africa, are revising their treatment algorithms for bipolar disorder, schizophrenia, mental health, acute mental health crises, depression. And we've been included in that process. We've been taken along by the psychiatrists and clinical psychologists into that forum. And so the treatment algorithms have now been expanded on to provide that all psychology interventions are provided by clinical and or counseling psychologists. So we're making inroads there. So I think we are kind of marketing ourselves better. We're getting it out there. The regulators are starting to take note. The funders are starting to shift. So I think that's a big opportunity for counselling psychology. As I mentioned, counselling psychology is largely what happens on the ground in South Africa. In the private healthcare sector, what psychologists do out there is largely counselling psychology in practice. And yeah, we need to just kind of expand on that and keep going with that. And as I say, the African cosmology culture is more closely aligned. My personal experience, I found that most Indigenous South Africans tend to respond better to counselling psychology interventions rather than clinical psychology interventions where you are viewed as an organism to be treated. So the collaborative approach, the more sort of humanistic approach of counselling psychology just works better in South Africa. That's a big opportunity for counselling psychology to go forward. So yeah, I think that kind of sums up the opportunities. The challenges, well, yeah, as always, we've been overshadowed by clinical psychology. Counselling psychology in some ways has always been viewed as the stepchild of clinical psychology, and that's a perception that we have to fight against. It's one that we have to work against in marketing our profession as counselling psychologists. Because as I say, legally, we are the equal of all other psychologists in this country, because psychology is a legislated profession. It's a regulated profession in South Africa. So we do have regulatory oversight. We just need to get out there and market ourselves better.
Thank you, Charles. And Charles, what are your thoughts on this?
Yeah, I believe opportunities are quite similar. Rather, we have bigger opportunities because we have to deliver to such a huge population, and we are in the infantile state where actually we are growing. And post-COVID, I would say that clients have also started coming up searching for counseling psychology instead of psychiatrist or a clinical psychologist. So that's a very positive thing. But in India, we see challenges are quite different from what I'm hearing from all of you. That the biggest challenge that we face is not, differentiating from clinical psychologists. Rather, we are finding it to differentiate between non-psychologists who are claiming themselves to counselors and counseling psychologists. So this is a struggle. This is a continuous struggle that we are going. A lot of people do 3 days workshop and start calling themselves therapists because this segment is not regulated. A 2-day workshop or somebody done a life coaching workshop or an NLP workshop, and they all start calling themselves counselors and psychotherapists. So that is the area where we are actually struggling a lot to separate and create a distinct identity among the regulators and also among the population and the clients.
Thank you.
But I'm very hopeful that because new courses are coming up every year, new diplomas are starting for counseling psychology. Master's programs are opening up. Psychology is like booming in India at present.
Thank you. Thanks. Charles, can I ask you to say a few words, please?
Yes, I mean it's always encouraging. So it's different countries, I think, going through different cycles. So where in Australia, for example, the future does look bleak, it's good to hear that certainly in India it's a growing specialty. In South Africa, sounds like a long overdue recognition. I do hope that there will be a re-emergence, a sort of phoenix rising from the dust. Yeah, I think until Australia has more people, I think at the moment there are more people joining counselling psychology in Australia from other countries than there are through its own training program. So without that, that is the lifeblood of the profession. You can already see in about 2016 surveys of the average age of psychologists was highest in Australia. And that mean is just going to get higher and higher as long as there are so few people entering the profession. But hopefully that will change, and there is some work to do exactly that, and there are some reviews of the Medicare system which has caused these problems in the first place. Thanks, Yetunde.
Thank you. Thanks, Charles. I think we can go to Chloe, who is going to speak to the Counselling Psychology Position paper that we've been trying to put together between colleagues on the panel, but colleagues who can't be here today. Chloe?
Yes, can everyone see my screen and hear me okay?
Yes.
Perfect. Okay. So my name is Chloe Donahue. I am a trainee at the University of Roehampton, just finishing up my doctorate in the UK. And I'm going to spend the next few minutes or so talking to you a little bit about the position paper that we've been working on as a Global Counselling Psychology Forum. So first of all I think it's kind of clear from the discussion, but just to reiterate, why do we want to have a position paper? Keeping in mind that the aim of this paper is to really provide an in-depth, evidence-based and detailed report of what counselling psychology is and what counselling psychologists do. And we want to do so in a way that's applicable for a very wide variety of audience, because it might be used in quite a few different capacities. So keeping in mind that the audience may not know anything about what counselling psychology is or psychology in general. So our first reason is information dissemination. We really want to be able to share very widely with all different audiences about what it is counselling psychology stands for and about what counselling psychologists do. So really giving your readers an understanding of our philosophy, the theories that we come from, and core competencies of a counselling psychologist. Then building on top of that, if we have this evidence-based document, we really do want to use it and plan to use it in a way that is problem solving and addresses some of the challenges that we're seeing in various nations. So we do know that in some nations, counselling psychology is thriving, and courses are newly being funded. And then in other areas and parts of the world, we see a bit of a dwindling of the profession, as we've been discussing. And I know in the UK as well, we've had course closures and things like that. So we do really want to use this position paper to address some of these issues that we're facing as a profession. And then lastly, for policy development, perhaps one of the most effective ways to problem solve and to address some of the issues that we're facing is through using is to inform policies and regulations and legislations. So by providing a comprehensive overview of what counselling psychology is in an evidence-based manner, through the position paper, what we can do is actually have supporting evidence when we go to make these arguments. So now I'm going to talk to you a little bit about the contents of the position paper. please do keep in mind that at this point it is very much in its draft form. And I'm actually in the process of writing up the final section. So this has also been, though I've been leading on it, this has been absolutely a collaboration of everyone together at the Global Counselling Psychology Forum. Again, keeping in mind the audience and the wide variety of audience that this might be applicable to as a position paper, we really wanted to start from the ground up. So therefore, our first section is really focusing on the history of counselling psychology. Now, as Charles mentioned in the beginning, and as many of us know, we do really appreciate the fact that the history is slightly different depending on the area of the world that you're in and the nation and community that you're a part of. But we have found that there's some commonality across globally and internationally. And it essentially comes from that idea of, counseling psychology emerging through the tension of empiricism and constructivism, through the medical model and humanism. In this section of the paper, we also have briefly some history according to different nations that we've been able to research and find, and wonderful colleagues have also been contributing on. Following from that, we then go into the philosophy of counseling psychology. So here, again, being very mindful of different cultural influences and things like that around the globe, we did find that there were three kind of core main tenets that counseling psychology seems to have internationally. The first one is that, and as I'm sure everyone knows, that scientist practitioner model of being that researcher side, that evidence-based side, and then balancing that with this practitioner side as well, and how the two can then inform each other. We then talk about our strong commitment to social justice. And as I mentioned earlier in the history section, certain nations, counseling psychology is very much rooted in Indigenous psychology and community-based psychology. So this has been something that's kind of really come with counseling psychology from the beginning and remains to be an important philosophy of ours. And then we also highlight being reflective practitioners. So if we believe in this idea of constructivism, then we also acknowledge that we are individually making our own meaning as psychologists in the room. And as counseling psychologists, we actively engage with that and we don't hide from that. So providing those two kind of sections in the beginning gives us a helpful context of where counseling psychology comes from and what it stands for. And then the third section is actually where we get into the really meaty bit of the paper, and a lot more detailed in terms of looking at the core competencies of a counseling psychologist, and also addressing the different settings that counseling psychologists working within, in that it being very flexibly and across a wide variety of settings. So I think this is also where we are mindful again that there are different nations and cultural influences on this, but what we're seeing internationally is this core competency of a counseling psychologist that I've listed here. So firstly, that therapy and intervention, our ability to draw from a variety of modalities, our assessment and formulation, our ability to gather client information and formulate that in a way that informs our interventions and mental health difficulties with the individual we have in front of us, psychometric testing, neurodevelopmental assessments, things like that. Supervision as well is something that we highlight as a competency of counseling psychologists. I know again in the UK that's something that we've had to have a conversation a bit about in terms of being able to supervise a variety of mental health professionals. Research too, again going back to that scientist side of us, and servicey policy and development, really highlighting that counseling psychologists can take leadership positions, and that we can use our skill set to further the policy and development at a higher level. So after getting quite detailed in that section, then we kind of take a step back and go, okay, well, why a counseling psychologist? What unique value do we bring as counseling psychologists? Why would a client want to sit down with a counseling psychologist, or why would anyone want to invest in counseling psychology over other mental health professionals? And for this, in a really lovely way, we kind of go back full circle, hitting on some of the history, philosophy, and competencies of counselling psychologists. So again, addressing that feedback loop of the scientist practitioners, our active stance and reflective practice, I think is quite unique to us, being able to name that. And our training in a variety of modalities as well, really highlighting that as a unique value of counselling psychologists. And again, our very strong commitment to social justice. So our willingness and ability to be able to meet clients within the systems and contexts that they're working in, with the cultural influences and community influences that they may have as well. And then in the final section, as I said in the beginning, this is something that we're still very much writing up, though we do have an outline for at the moment. And really, it's looking to the future of the profession and the sustainability of the profession. So what we currently have in that section outlined is looking at a potential global framework, a working framework that has a core, where then each nation and locality and community can then balance that within what makes sense, given their cultural influences and their community needs. And the idea behind this, again, is that we really want to be able to utilize these resources as a way of addressing some of the issues that we're facing as a profession. So whether that be through funding of courses, or through addressing it with various services or regulatory bodies or legislatives. So thank you for listening. And I believe we will have a question and answer section now.
Thank you, Chloe. That was awesome. Thank you so much. As you can see, there is a lot of work in the background with colleagues around the world. And we are really thriving, as Chloe and our panel members have discussed, to ensure that we continue to build the visibility of counselling psychology where it may be lacking or where we need to do more in the recognition of counselling psychology. So we're at that junction where we would like to invite questions, reflections, thoughts from our colleagues who are attending today. Please unmute yourself if you need to, or have a hand raised using the technical things at the bottom of this. Well, it's at the bottom of my screen. It might be on the right hand side for you. Sorry, I'm not very technological at the best of times. So there's a hand raise option that you can have if you would like to have a ask a question or perhaps share some thoughts with us this morning. I can't see anybody's hand up. Okay, so first of all, I can see Nicola. Do you want to come in? Hi, Nicola. Good morning.
Hi, good morning from South Africa. Given that in practice, or practically, clinicals and counselling do, there's really a great deal of overlap. And I know when we were trained that, it was our values that distinguished us. And yet, I find many clinicals who, embrace multiculturalism, community service, social justice, and all the rest of it. Is there a move to combine the professions? And if so, what are the panel's thoughts on that?
Thank you, Nicola. That's really, really interesting. That I'm sure that each one of us has our own thoughts about that. But I'm going to come to Mike first. Do you what are your thoughts on Nicola's point around the merge?
Yeah, there are a couple of things happening in South Africa at the moment in that regard. The one of which is there's currently a transversal re-registration opportunity that anyone in a category of registration, such as counselling psychology, has a limited 2-year window of opportunity to re-register in another category. So counselling psychologists can apply to be re-registered as clinical psychologists, although then they will sacrifice their counselling psychology registration, which is a threat to counselling psychology because it has the potential to diminish or reduce the number of counselling psychologists in South Africa, and thereby make the profession even less viable. I also know that our regulatory body, the Health Professions Council of South Africa, is going to be running a series of seminars or consultative conferences across the country in the coming months They've invited us as counselling psychology to get involved, and they're talking about restructuring the entire profession to move more towards an Australian model of a generalist psychologist, and then clinical and counselling would become an endorsement or specialization after one's attained the status of a registered psychologist. But that is all still pretty much up in the air. It's conceptual at this stage. It's a discussion document. We don't know where that will go to or how it will turn out. That's probably going to be a process that's going to take several years. So the merge, it's possibly going to happen in South Africa, but it's as clear as mud right now.
Thank you, Mike. I suppose just to share my thought on that, I think we have to remember that the ethos of clinical psychology and counselling psychology are very different. And therefore, even though our implementation of our practice, there is an overlap, I do still think that fundamentally we're different. And if we're in a global world where we continue to highlight issues around mental health, mental well-being, physical well-being, and we bring as counselling psychologists this holistic perspective, to me, it doesn't make any sense to have the merge. I think that we can complement one another, and you know, we work pretty well with clinical psychology colleagues. And so I guess my own personal perspective, certainly I'm based in the UK, would be that that isn't necessary, and it's a way of finding how we work better together, not just as colleagues, but within the sphere of psychology regulatory bodies and funding. Can I come to Anshitosh very briefly to give some thoughts as to your indication as to whether you think a merge between clinical and counselling psychology? And then I'm going to come to Dirk, who has his hand up, and then Sue.
I resonate what you said, Yetunde. It is absolutely true that though we are coming from a different, similar training, but we look at our clients from a different lens. We have different ethos, we have different, even therapeutic goals are sometimes different. So there is a separate identity and it should be remain same, but we need to advocate, fight, and you know, make our governments and regulators to keep these identities separate and not merge, because, and I believe they are doing it because they don't know the difference. So we need to come up with more documentation, more research, more policy documents like one we are preparing, and making people more aware and educated about who we are and how are we different from other specialities.
Thank you, Anshitosh. Dirk, I can't see you. Do you want to jump in?
Can you hear me?
Yes, perfectly.
Good day, everybody. I'm going to throw some a spanner in the works, so I apologize if I ruffle some feathers there. But what if, with all the research we do, we find that there is actually no difference between, or very little difference between clinical and counseling psychology, except for the area in which we do our practical training? Are we not trying to sustain, to really find a way of keeping something going, a difference going that might not actually exist? Isn't there, so maybe the question is, shouldn't we start working towards finding, maybe like in the Australian model, a combined way of practicing psychology in which everybody is just treated as an equal? I think, you know, the three sections, counseling, educational, and clinical, are in a way there's a huge overlap, except, say, for where people work in hospitals or work in schools or work in private practice. And we in terms of using the theoretical background and so on, our own theoretical positions, there's a huge overlap. This is what I've been hearing that's been said, that research is showing. So why do we want to continue to have a distinction? And maybe this is something that we really need to clear out. Why do we want a distinction when there is actually very little distinction? And shouldn't we, for the future generations, as it were, work towards having a model that will not have us fighting each other, but rather work together? I mean, South Africa, very few people have the opportunity of seeing any psychologist, I guess. And if we look at the rest of Africa, that is the same case. And from what I've been hearing, the same thing is happening in India and I guess many of the other countries. So we're wasting many resources in trying to position ourselves instead of, you know, holding hands and giving our support, our you know, practicing where it is needed. So just a comment there.
Thank you, Dirk. I'm going to come to Charles, and just we're mindful of time. There is one person who also has their hand up, who just so happens to be the incoming chair in the UK. Hi, Sue. Charles, what are your thoughts?
Yeah, look, I think it's this question has come up. In the 1950s, questions were asked about why sustain counseling and clinical psychology in the US. I think to some extent it perhaps depends where you're located. I think if you're an American counseling psychologist where the specialty is flourishing and has status, and I don't think it's really an issue. But it's a personal opinion. I chose counseling psychology specifically because of the values it represents, and I would be sad, you know, because I don't think what would happen ultimately is if we merged, that would probably be the end of counseling psychology. You know, we would just be absorbed within clinical psychology. But I understand, you know, the counseling psychologists in Australia who are struggling, and, you know, it would be a solution to the challenges, but it's not the correct solution. The correct solution would be a rebate system that treated counseling psychology equally. So that's my view, but I appreciate it. You know, in my opinion, might change from day to day.
Thank you, Charles. I'm going to come swiftly to Sue, just so we can get your thoughts, Sue, and then I'm going to go to Tanuja. Sorry if I haven't said your name correctly. And then I think we'll have some last words, and we'll be finishing for today.
Hi, Yetunde. Hi, everyone. As Yetunde said, I'm the incoming chair of the division in the UK. And Yetunde will also tell you I don't mind being a bit controversial when I speak as well. And I wonder sometimes if counselling psychologists are a bit guilty of being too navel-gazing. I've heard a lot today about how we position ourselves and our training and our identity, whereas maybe what Dirk was trying to get at is we are here to serve the public, and for most of the public, they don't know whether we are clinical counselling, health psychologists. They just know that they need help, and maybe that needs to be our focus sometime as well. On saying that, I also have a tension that I chose counselling psychology because of the values of counselling psychology, but I'm well aware that a lot of my clinical colleagues have the same values now, and there is little difference there, but that it is an issue that we are not noticed in the UK, if you like. Our figures, certainly within the NHS service, are subsumed within clinical psychology. We don't know where our counselling psychologists are actually working. Now, there are a significant percentage of our NHS workforce is counselling psychologists. But they're often recorded as clinical psychologists when the data comes out. And we've recently had a long-term workforce plan produced here for England, which is about promoting a substantial number of clinical psychology training places without actually considering all the other psychologists who are working in the NHS. And I wonder whether the data, in fact, is actually accurate in producing that plan because they subsume the other psychologists within the planning process. So I've got mixed tensions about this, and I just wanted to share those points of view.
Thank you, Sue. Thank you. I'm going to come very quickly to Tanuja. Are you there? Are you able to speak? Tanuja, are you still with us? Okay.
Yeah.
We can hear you.
Hi, good morning, and thank you so very much for. Hello.
We can hear you. It's a bit of a dodgy line, but we can hear you nonetheless.
Allowing me to allowing me to share. I have joined quite late, so I'm not sure these points have been discussed, but with 23 years in the field, I could very clearly notice it, experience it, and would like to put it forward that when we talk about the counseling requirements, isn't it, when we talk about counseling, is quite an umbrella term in terms of the issues or the audience it may cater to. General to specific when we go, it could be either clinical, marital, child, or education, as the discussion was going on. I would like to put forward the two perspectives. One, which is more of the expertise or the professional focus, and another is the audience focus, the clients whom the services are going to be provided. So the clarity need to be there who need to reach whom in a given situation. I believe the counseling psychologist, that is a profession which can be reaching out to masses as compared to clinical psychologists in comparison when we're talking about where they deal with more specific or more intense issues. So I would like to propose, or I would like to, share the perspective that we as a whole need, as professional team of professionals, need to have this clarity that when we propose any sort of distinction, we need to consider the audience focused approach and secondly expertise. For example, I would not like to deal with more intense cases which a clinical psychologist would like to. I'm a counseling psychologist, right? And I know as a counseling psychologist, when I could reach out to the masses, I'm quite good at that up to the extent where I have to provide my services. And if it's all required, I could make requisite referrals, be it to the clinical psychologist or a psychiatrist further on. So I'm in favor that we need to work upon this, and the clear distinction would be in favor. And this last point, which I would like to submit here is, for example, in India, there are so many advertisements when come schools or education organization asking for clinical psychologists. And I do wonder, what sort of audience are they catering to? Is this school-going children or the colleges students, do they need the clinical psychologist services, or they need a friendly counseling psychologist who can make requisite referrals if at all required? With this, I would like to thank you, everyone. Thank you.
Thank you, Tanuja. We are slightly over time by 5 minutes, and we are going to swiftly bring it to a close and be boundaried with our time. But before I do that, I just want to get just last words from our panel members and Chloe before we finish, and we'll certainly looking to put more on of these type conversations. Charles, I'm going to come to you first.
I'll be very quick just to say, yeah, thank you. It's been an interesting discussion. I feel that the choice for counselling psychology is to more actively promote itself or to merge with clinical psychology, and I hope it'll be the former. But thank you for your time.
Thank you, Charles. Mike?
Yeah, I can echo those sentiments. I think this has been very useful just in terms of generating some ideas and stimulating the discussion and debate. Yes, we'd like to do more of these going forward. It's useful to get grassroots input because when we meet as a panel, you know, we've got our opinions, but it's good to hear from broader membership. And so, yeah, this has been great in reaching out and getting more people involved. And so this is great. So thanks, Yetunde, for the effort that you put into it. Charles, in arranging it. Thank you. Chloe, and all the work you've done. Yeah, you've done an amazing job of writing up that document, and I think you've captured it very well in your PowerPoint presentation. And yeah, looking forward to more of this.
Thank you, Mike. Yay, Chloe. Why don't you come in here, Chloe?
No, I just want to say thank you. It's been a really helpful discussion. I agree with everything that's been said before. I think it's really helpful to hear lots of different perspectives, because when we do meet at a panel, it is a smaller group of us. I'll leave it there for now and just say thanks.
Thank you, Chloe. Last but not least, Ashutosh, final thoughts?
Yes, we are a great profession, great team, great opportunities, and great challenges. So I'm sure that we will be doing great service to the community around the world. Thank you very much.
Thank you,
everyone,
Ashutosh,
for joining us.
Thank you, Ashutosh. Thank you, everyone, for joining. For some of us, it's a very, very early morning rise without coffee, but we made it. Thank you. Please look out for the link. We look to be doing more of this and getting more discussions going. There are challenges, but there are also beautiful things coming out of counselling psychology. And we hope to be able to share this amongst ourselves and build a global community together. Thank you, everyone. Wishing you all a pleasant day. Take care. Thank you.
Take care.
Bye.
Bye-bye. Bye.
Bye. Everyone, take care. Bye.
Thank you. Bye.